Hello, this is Dr. Benjamin Webb for the concluding module of this free course on plantar fasciitis. This is module 6. Thanks for hanging in there, and let's get started. So what I want to talk about today is what the comprehensive solution to plantar fasciitis or heel pain looks like. Now that you've figured out, okay, what are the individual elements of symptom management, which we talked about pretty extensively, also the calf stretches, plantar fascial specific stretching, how do we take all of this and bundle it into a comprehensive solution that is easy to do, easy to navigate through, but also highly effective in getting rid of your heel pain? So that's what the whole goal of today is, and I hope that you'll find some value here. So what does a comprehensive program look like? The key component is daily symptom management strategies, and that is those simple things such as icing, anti-inflammatories, proper shoe gear, inserts, even steroid injections. So those things that are essentially band-aids. They don't exactly take away the pain long term, but they allow it to take away or diminish the pain in the immediate time period in which you're using the product, if that makes sense. So these are things that don't actually fix the underlying biomechanical problems that are causing heel pain, but there are things that we can use to help diminish your symptoms, to allow you to live your life and to go on day to day. So that's what the daily symptom management strategies are. They cannot be emphasized enough. They should be done daily. When applicable, obviously you don't want to be getting daily steroid injections, but wearing supportive shoes and inserts, icing at night, taking oral anti-inflammatories as prescribed by your doctor, all of these things really play a role in decreasing those symptoms that you're experiencing. So the next few things are we actually get into reversing the mechanics. So we need to do the daily calf mobilization techniques. And I really recommend here at least 4 times a day. So times 4 a day. All right, that is key. So we really want to be doing this pretty aggressively, okay? And that's why that's there. The calf and the Achilles tendon is the largest tendon in the body. It is highly resistant to change, and so you really have to get aggressive. And you also have to vary the technique. So these calf stretches don't just do the same stretch every day. You're going to have to varying angles and different stretches to kind of access and stretch different parts of the calf and the Achilles tendon and the foot. That will actually be more effective long term in decreasing your plantar fascia. Most people do the same calf stretch day in, day out, and they wonder why they don't have any progress, or they might even be making it worse. So varying the stretches and the different types of stretches are really recommended in being most effective at getting rid of heel pain. And then this last one, addressing intramuscular adhesions. I don't think this one is emphasized enough in the medical community, at least at the entry-level podiatric visit or orthopedic surgeon visit. This is not something that's really emphasized. So different strategies for this include foam rolling, voodoo flossing, lacrosse ball smashes, a whole bunch of different kind of therapy techniques that reduce those intramuscular adhesions. And that's important because you got to restore the sliding surfaces of all those different tissues. And if you don't really do that, a lot of times you're not going to see the progress. You're still going to be limited with your ankle range of motion, and you're being able to stretch those calf muscles out. And so some patients aren't really seeing progress in that area because they're not actually reducing these intramuscular adhesions. Okay, they're kind of hitting that wall. So I think that is a very important thing to have in a comprehensive plantar fasciitis or heel pain program. The third is the keystone or the foundation of this whole program, and that's the plantar fascia specific stretches. These are programmed daily, and again, I recommend doing these 4 times a day. And they've actually done, as I mentioned earlier, head-to-head studies, and the plantar fascia specific stretching is has shown to be more effective in reducing heel pain than daily calf stretches. To me, the plantar fascia stretching and the calf stretching are each a side of the same coin. And so you really have to have both to really attack the problem in all directions. And so I really recommend incorporating plantar fascia specific stretching and calf stretches together as a comprehensive program. And then structure and accountability. This is, again, one that I see a big problem with the patients who come back to me in 4 weeks after my initial visit. I follow up with them and say, hey, how's the stretching been going? A lot of times they're just doing haphazard stretches. Occasionally, they might miss a day or two in between. And inconsistent stretches give you inconsistent results. So you really need to focus on structure. Do you have a daily goal? Do you know what your baseline was before you started stretching? Have you identified where you're at so you can track your progress? This is a key thing that I think is especially important in making sure that you're actually seeing the results you want to see. And then accountability. Are you holding yourself accountable? And the best way to do that is with a friend or a family member. Heel pain is debilitating, and if not addressed, can really disrupt your life and the things that you want to do. So if you have a family member or friend who loves and cares about you, which they do, then they're going to want to see that you get better so that you can do those activities that you want with your friends and your family: hiking, walking, exercising, being there for them. And so recruit a family member or friend to keep you accountable with the stretches. They'll give you a call, a text, whatever it is. Hey, have you stretched today? Have you stretched 4 times your plantar fascia? Have you stretched 4 times your calf muscles? Have you logged it in a plantar fascia a journal or a progress log? That is so key in keeping yourself structured and accountable. So this is kind of what a comprehensive program for plantar fasciitis would look like. So we need to really attack this problem from all directions. And this is important. So in a comprehensive approach, you need to have proper order. The order that you do your stretches matters. You build upon each stretch, okay? And then structure is important as well. Timing. When are you doing which stretch? Are you doing certain stretches in the morning and certain stretches in the evening? Okay, there's certain timing on stretches that is important, and how you progress those stretches. So this is key. Proper form and technique. You have to have proper form and technique. And that is where a lot of patients get in trouble is, I do demonstrate to my patients, this is how you do this stretch, and I give them a handout, but sometimes that still isn't enough. So having a way such as a video or something that you can follow to get proper form and technique is important, because if you're doing this wrong, you're not going to see the results that you want. And you have to go out of your comfort zone and be aggressive. You have to build time into your day to do this. Just doing it quickly before you hop out of bed, quickly at the end of the day, that's probably not going to give you enough stretching and time to really focus on those daily symptom management strategies to really see improvement. So give yourself some love and be patient about this. Remember that this has developed over several years. You may not have known it, and it may have come on suddenly out of the blue, but this has been going on for years and years and years as your calves have slowly tightened up, as your plantar fascia has slowly tightened up, and the inflammation and the degeneration of the plantar fascia starts to build. Okay, so give yourself the time that you need to get over this. Remember that the literature shows that 90% of people will improve in 10 months, okay? That sounds like a long time, okay? But, a lot of patients see significant improvement in half that time, okay? But complete resolution can take up to 10 months. And this is the number. If you've been dealing with this for over 10 months, you have to ask yourself the question, okay, have I truly been honest in how committed I've been to beating this with my daily routine? Have I truly kept track of and held myself accountable? And if yes, and you really have been, and it hasn't improved in 10 months, then you may need to speak to your doctor about surgery. Okay, and so there are surgical interventions that can be done. Again, those rarely remove the heel spur. The heel spur is not the problem. I repeat, the heel spur is not the problem. Burn that into your mind. Just because you have a heel spur on the bottom of your foot does not mean that is what is causing you pain. So the stretches and doing all those things, that is really where the rubber meets the road. Okay? So a 4-week plantar fasciitis program. So because of this need and this, what I've seen with my patients, I developed a 4-week plantar fasciitis program to help patients take the complexity out of all this. Basically, they can just plug and play this program, and it will guide them through the stretches they need to do every day with the appropriate pacing and tempo and order and progression to be able to get the most benefit. Okay, I've done the research here and looked into all this to really kind of develop this plan and different things that even a lot of doctors aren't really including in their programs. So this is a 4-week video guided self-treatment designed by myself, a foot and ankle specialist and surgeon. It's a totally comprehensive program that'll address your heel pain at each level of the problem: the calf, the plantar fascia, the sliding surface adhesions, the intramuscular adhesions. All of that is addressed in this program. So you're going to learn advanced techniques that aren't really gone over in a first patient visit with your doctor. Generally speaking, they're not going to go into intramuscular adhesions. They're going to show you a couple quick calf stretches and say, good luck. They might tell you roll an ice bottle under your foot or a ball, and that's it. But this incorporates all those things plus advanced techniques and stretching modifications, really that will give you the most benefit. So you're going to learn the same techniques used by athletes and athletic trainers at the highest levels to improve your range of motion and reduce your pain. So let's do some math here. So in the 4-week program, you do 3 sessions per day, and 3 sessions per day for 28 days. It's 84 total sessions, okay? There are 12 unique sessions, meaning that there's 12 sessions where we are adding stretches and changing things around, and then you will repeat some of those sessions, okay? So 12 unique sessions. So if you were to pay a cash pay visit at a podiatrist, you can expect to pay $50 to $300, on average about $150 cash pay. And at a physical therapy, your average is about $125 a visit. Okay, so if you were to average that out and do the math, at $150 for the podiatrist for 12 visits, that's $1,800. For a physical therapy, $125 per visit at 12 visits, that's about $1,500. Most people don't have that kind of cash to spend on this problem, okay? That's a lot of money, all right? In addition, I feel like this program saves you money, and also that you're going to save valuable time and money by not having to travel, take time out of your day to go see the therapist or the podiatrist. So that's going to save you about $300 over the course of a month. You'll keep yourself accountable with the plantar fasciitis workbook that's included in the 4-week program. They help you determine your baseline and help you keep track of your progress. That's a $100 value there. And then, so your total value is going to be around $1,900 to $2,200 for this program, if you break down what the average costs were to meet with a specialist for this. Again, that is a pretty astronomical amount of money that most people do not have the ability to pay that. And so I wanted to make this affordable and be able to get in the hands of as many people as possible so that they can get back to their life and get on their feet. So I have made this the cost of about $29.95 is the cost of this 4-week program. So just a little over $1 a day. You're going to be taught how to effectively eliminate your plantar fasciitis and your heel pain. You probably spend more money on your coffee each day for sure. So this is going to give you get you back doing those things that you love quicker. Okay, so I really think that this is a valued program that can really help you in the long run. And the nice thing about this is once you purchase this, you own this. So your plantar fasciitis comes back in a couple of years, you can always just log in, start the program again. So it's an incredible value. So some of the barriers I just want to discuss to progress with plantar fasciitis that I hear a lot from patients are these different, thoughts and excuses. They've said, I've tried stretching, but it didn't work for me. Well, how honest have you been with your stretching? Have you really committed to stretch 4 times per day? Has it been structured? Have you varied the stretches? Has it had proper progression? So, have you done plantar fasciitis specific stretching, which a lot of doctors don't teach this, even though there's compelling evidence and literature out there that state that this is more effective than calf stretches. So these are all things to keep in mind and ask yourself, okay, have I done these things and have I been as committed and consistent to really see results? Second excuse or reason people don't really progress is they say I've already tried all the products on the market and they don't work. Well, these standalone products are often gimmicky, I'll give you that, but they're designed to be symptom management. They don't address the underlying issue and problem that is causing you to have heel pain. These products are often great. They're good. There are good products out there, but the moment you take them off and stop using them, your heel pain comes back. So if you use the products with a comprehensive stretching plan, and you can actually have great success. Okay, so that is one thing that I highly stress with my patients. And then the third thing, I've been at this for so long, I think I'll just accept my pain as part of my new normal. Don't give up. Trust the process. Be committed. Start again. If you failed, get up and start again. This can be beat. Remember, if you follow this comprehensive program, you can beat plantar fasciitis in 10 months. That's the goal. But you can have significant improvement in the first month, second month, third month. And so you just really need to be committed and dedicated to this. So don't give in to the myth that you have to simply settle and accept this as your new normal. Okay, there are so many different myths and misconceptions about plantar fasciitis. That's been my goal with this 6-module course, to dispel those myths, and I hope that I've done that. I hope this has been a valuable learning experience for you. If you have any questions, you can always email us at info@heelspurmyth. Let me erase that. That can be confusing. info@heelspurmyth.com. So that's the email address. You can also go to heelspurmyth.com and sign up for the 4-week program. If you go there and navigate at the top tab, you'll see the 4-week program tab and the link for the sign up there, and get started on your recovery process today. I hope that this has been valuable for you. Look forward to getting you back on your feet and getting you on with your life. Stay safe out there, and I wish you all the best.